Hey, so good morning. So I'm Wally Gomaa, and I am CEO for ACAP Health, and we're out of Dallas, Texas. We are a research and consulting firm that really kind of got into space by accident, really started from some consulting work we were doing with mainly with insurance carriers and with hospital systems. And it was through that work that we decided we needed to also include as part of our organization work that we could bring forward to the employee benefits industry to bring measurable results. And I'm excited today to share with you a couple of things that we've been doing with the Healthy Business Group now for several years. One is a program called Naturally Slim. It's our metabolic syndrome solution. And the other that Dr. Bricker will talk about is a program called Compass, which hopefully you know a lot about the Compass program. Before we jump into it, though, I asked Tom if I could just take 5 minutes to do a little bit of table setting and kind of talk about where we are as an industry. And I thought this quote from David Suzuki that really, as an environmentalist, spoke perfectly to the challenges we have as a country right now. And it's really the folks in this room to really sort through that if we even want to have a chance to be able to have a healthcare system for the next generation. So if I asked you to take your watches out and count off how many seconds a million seconds would take, how many days would a million seconds take to click off of our watch? So I'll go ahead and say it's 11.6 days. If I said a billion seconds, how long would that take? So we'll say 31.7 years, and a trillion seconds is 31,689 years, and we have that times 19 as our federal deficit. And it's really what's, we've all been in the middle of with ACA that we think is the big thing that employers just haven't quite realized about the Affordable Care Act that is the main driver of spend. So if you kind of look at where we were pre-ACA, we had hospital system costs on Medicare really trending upwards. ACA came in there and it made a legislative change to how we pay for hospital system care that actually created a period of deflation. And what we had to do that because the Medicare Trust Fund was essentially scheduled to be insolvent in 2017. What we've really done is we've just kicked that can down the road. Our challenges with Medicare and really Medicare and Social Security is what represents the lion's share of the deficit are really the main driver of what's driving healthcare inflation for employers. So you kind of look at this further. We had 57 million Americans that are in the Medicare program today. That number is growing to 85 million as the baby boomers move into Medicare. And we're going to have far fewer beneficiaries pouring into the Medicare Trust Fund. The reason why we keep talking about Medicare every time we get in front of consultants or employers, it's the challenges with Medicare that is driving healthcare inflation on the private side. So you think about the federal government has completely given providers a haircut on Medicare, yet even though Medicare gave providers a haircut, hospital profits are at record rates right now. So where's the money coming from? So what's really happened is you see where Medicare was going on the hospital trust fund, ACA came in there and legislatively capped it. And what you've got is that the government's taking the money out of the hospitals' pockets, and then the hospitals are taking it out of the employers' pockets. And let me just say this, and without any disparaging to the insurance carriers, the medical loss ratio has removed the incentive for insurance carriers to be able to control trend. Because now, with an 85% loss ratio, the higher healthcare costs go, the more that insurance premiums can get also. We're in a world of hurt right now. And we're not going to just finance our way through it. What we really look at right now is that this hidden Medicare tax that's affecting employers, it is at crisis levels right now. On a national level, we're at 163% of Medicare. In this region, I pulled the data. Does anybody know where we are in this region of the country? Just take the Northeast. 221%. So that's the delta. 2 patients laying in the hospital have the exact same services. On the private insurance side, we're paying 2.2 times more than the Medicare reimburses. And that's a cost shift that's happening that is dramatically influencing healthcare inflation. The other big challenge we have, so you think about what's happening on the unit cost side, is we now have 1 out of every 2 Americans, not in the future, this is today, that are either pre-diabetic or living with diabetes today. It's hard to get your head around that. 1 out of every 2 of us. We use this escalator as an analogy that if I'm standing on an escalator and I'm just standing still, which direction am I going? Going up. And normal, it takes somebody who's pre-diabetic is running at about $2,500 per year, for a pre-diabetic on a commercial insurance plan. When they get up to the second floor, depending on what study you're looking at, it's anywhere from $18,000 to $22,000 per year, average cost per type 2 diabetic. And what we really need to do is we need a solution for our country that can absolutely not just hit the stop button on the escalator, but actually hit the reverse button. Now, when you advise clients, for the employers in the room, the insurance carriers, diabetes doesn't usually make the top list of the big 3 areas of spend. So what are the top medical diagnostic categories? So you got cancer, heart, and MSK. So when we look at diabetes, a lot of people wonder why we focus so much on diabetes. Think of that as the gateway condition. You would see is that there's this overlap of these 3 boxes. Diabetes is the gateway condition that is driving all of it, and 1 out of every 2 of us are either pre-diabetic or living with diabetes today. And we can change it easily. Like, we absolutely can. Fixing healthcare, I think, Tom was saying this, so my background, I was formerly I was a financial officer for a large hospital system in the Houston Medical Center, and then I defected to the other side of the fence, and I was president for one of the medical carriers. And when we look at this really difficult algebra equation, it's price times use equals cost. And so what we really want to talk about today is 2 very simple ways to affect use and price or unit cost. And when we do that, what the Healthy Business Group has enjoyed and other organizations is the elimination of healthcare trend without having to go through all the deductible cost shifting, nonsense that we see happening a lot. Now, I don't want to spend a lot of time talking about Naturally Slim. I'm going to give you just a boring bullet point slide and then just share a few results with you. But this is today the largest program in the country, has worked exclusively historically in the employee benefits industry, designed intentionally to reverse prediabetes, metabolic syndrome, and obesity. And kind of what we're known for is that when we work with an organization, we give a 100% performance guarantee on pre and post clinical lab results. If the lab data doesn't go back to normal, not improve, but go back to normal, then we don't bill for the cost of our services. That's a big part of what we do. We use evidence-based skill building. Make no mistake about this. The challenges we've had on our obesity epidemic are not related to what we keep trying to do as an industry. It drives me crazy. We keep thinking it's a matter of education and motivation. If you go back and you look at people who've struggled with their weight, it's not a lack of education. Ask a heavy person the calorie content for a muffin and they'll know it. It's true. And it's not because of lack of motivation. People that have struggled with their weight, they think about losing weight every single day. The reason they've not been able to be successful at losing weight is we haven't helped them develop skills around their food. If I want to be a better golfer, it doesn't matter how much you pay me or you educate me, I'm not going to just magically be a better golfer. What do I have to do to be a better golfer? And if I practice something enough, what do I form? Skills and then habits, exactly right. So that's where we've missed it as a country. It really is that simple. And if you can teach individuals the skills that naturally slim people do naturally, because they're not genetically gifted and they don't just have a fast metabolism, how they eat their food is different than the rest of us. All right, so that is really at the heart of what is in the curriculum of Naturally Slim. 100% delivered through technology. So if you've got a smartphone, a computer, or a tablet, we're going to reach them. Meets the latest federal treatment obesity guidelines. So our chief medical officer and then all these people that have joined our team, over this last decade that we've been on this mission to try to change the world, are really the thought leaders in the clinical community. These are the folks like Dr. Tim Church, who is, a world-renowned researcher and public expert in the space, who's helped us to take where we are today and evolve it to the next generation. Now, remember this, the Affordable Care Act requires for all non-grandfathered plans a requirement that obesity counseling must be covered as a preventive care service. So if an employer is not making these services available today, they're not providing support on the essential benefit list. So a lot of what we do helps employers to comply, with that requirement. I'm going to skip just the interest of time and talk about kind of where we are. Today we have, we're constantly going through research and publishing through peer-reviewed studies. This is one from the metabolic syndrome and related disorders that was published last year. I'm going to tell you, just like disease management got a black eye several years ago, I think wellness is coming there next, just to be very transparent. And we don't like to say what we do is wellness, because I think depending on where you are culturally as an organization, wellness has had a hard time being able to deliver measurable clinical results and financial results. So we like to say, please don't call what we do a wellness program. It really is a clinical intervention program designed not just to improve clinical lab values, but return them back to normal. If we don't return clinical lab values back to normal, not just improve them, but actually get them back to a normal level, the ability to eliminate healthcare trend becomes almost impossible, because we're just producing too much disease. We're producing too much disease. What we do virtually every time that we implement this program is we help reduce the number of people with obesity, prediabetes, or metabolic syndrome. We slash it in half, and we do that every single time. Last year we implemented this, we did 1,200 implementations of this program, 1,200 employers. We provide the 100% performance guarantee, and we've never missed on that performance guarantee a single time. So we know how to do it now. We know what we were doing wrong. Everybody always asks the question, how do you get people engaged, right? How do you get people just to do it? What is the one thing that 72% of Americans do every year? They do it voluntarily, and nobody's ever asking them to do it around their health. They start what? I'll give you a hint. They start on January 1st and a Monday. They start on January 1st or a Monday, start a diet. And by Tuesday, they're off their diet. Nobody starts on the weekend, right? They don't. And it's true. This is research. And then you know what? By Tuesday, they're off their diet, and they start next Monday. And that next Monday, that's the Monday this is the year I'm going to do, this time I'm going to do it. And they look up, and it's 10 or 20 years later, and they haven't done it. I lost 146 pounds. I get what it means to struggle. All right. I used to be, in full disclosure, 6'7", though. I didn't tell you that part. So when we look at graduation rates, we're 82%, not 1 or 2%, but 82% of people that we enroll graduate from the program. What do you think is the biggest motivation for someone that we engage with to be successful? By far, it's the thing that gets people engaged more than anything else. It's they've enrolled in a program, a weekend, they stand on the scale, and they're like, no way. I never thought losing weight could be this easy, because we've had the playbook wrong for a lot of years. We think it's about, eat this, don't eat that, or blood, sweat, and tears in the gym. Look at the Biggest Loser TV show and look at the actual alumni from that show. They're not doing well because they didn't learn the skills. We thought it was all about accountability.